A high fever, a sudden stiffening of the body, eyes rolling back, followed immediately by severe, involuntary shaking. For a parent watching their child experience this without warning, the immediate reaction is overwhelming terror. But there is a precise medical diagnosis for this event. It is a febrile seizure, or spike in body temperature. The young nervous system reacts to this rapid heat increase by short-circuiting, resulting in the convulsions. Because this short circuit is a highly common, heavily documented reflex, parents must shift their mindset. The priority is to transition from being a frightened witness to a focused first responder. The overarching rule for a first responder in this situation is that absolute calm is required to execute the protocol. When panic takes over, caregivers instinctively rush in to physically force the episode to stop. Those interventions introduce severe hazards to a vulnerable child. The primary medical objective during the active shaking phase is remarkably passive. You do not try to halt the seizure. You simply let it run its natural course. The correct response requires minimal intervention. Your job is to prioritize a safe physical environment rather than trying to override the body's convulsions. Securing that environment starts with the space immediately surrounding the child. As this diagram illustrates, there is one mechanical action required: gently rolling the child into a sideline position. The anatomy dictates this position. Gravity creates a clear path for oxygen, ensuring saliva or vomit drains downward instead of pooling in the windpipe. While on their side, do not attempt to hold them tightly or restrain their shaking limbs. Restraining a convulsing body pits your strength against severe involuntary muscle contractions. Pinning down an arm or leg can cause severe muscle tears or bone fractures. Positioning gravity to protect the airway is the only physical manipulation you should perform. Let the body move freely otherwise. That hands-off rule applies even more strictly to the most panic-driven mistake caregivers make: attempting to pry the child's mouth open. No spoons, no fingers, and absolutely no pouring water. The jaw muscles clamp down with immense pressure during a seizure. Forcing an object past the lips frequently results in shattered or dislodged teeth. Furthermore, placing anything inside the mouth, solid or liquid, creates an immediate choking hazard, threatening to fatally block the exact airway you are trying to keep open. Attempting to physically override the jaw or the limbs takes a neurological reflex the body can endure and turns it into a deadly mechanical hazard. The intense shaking feels endless in the moment. In reality, a typical episode stops entirely on its own within 1 to 2 minutes. The medical reality is that this event does not leave the child with permanent brain damage. This heat map tracks the actual priority. Once the muscles relax, your focus shifts to the root cause, the spiked core temperature. You bring that heat down using standard protocol. Administer paracetamol syrup and apply cold water compresses to the skin to cool the body. The moment the physical shaking ends, the acute emergency is over. Your role returns to standard, manageable fever reduction. There is exactly one rule that overrides this recovery phase: watching the clock. If the active, shaking phase of the seizure crosses the 5-minute threshold, you must immediately escalate the situation and evacuate the child to a hospital. But inside that 5-minute window, calm observation and knowing exactly what to leave alone will always be your strongest defense against a febrile seizure.